It's a good reason to do this.
I think we worked together on something. We've been using Steve Arson and not the story. I don't know when I'm going to keep somebody else,
You were fabulous. It's an easy topic. When you believe in something, it's easy.
Although I felt this way at the end when I I'm going next. Yeah. Why not? I just got to get the paperwork so I can bring it back to the hospital.
I have to bring it back to my doctor.
Yeah, we have mandatory vaccines in my clinic and my in Shiprock. I spent a month in Gallup when I was a medical student. Yes.
Smile, Tom smiled, right? He set a good, Tom set a good example. I really do feel it. That was awesome. Thank you. As I said, this is great. I need a copy so I can tell the hospital where I work that I've done it.
Have you put the number on it?
Nothing yet, no.
Okay, cool.
No, really.
Right before we get it.
That's what looks like. No, it's
You validated it's me, and I filled out the rest of the form.
Okay, no allergies.
Penicillin, but not anything.
Are you doing the
Well, I should say I am if she doesn't scream.
Channeling my children. Thinking about them and how I'm not going to bring it. Always my babies are really big. The needle is. Here we go.
Mind your hand, please.
You okay? Yeah, no, it doesn't. No, it doesn't hurt.
Go ahead.
What motivates you to fight flu?
What motivates me to fight flu is to protect my patients and my family. We know that pregnant women are at particularly high risk for severe disease from flu, and so if they get the flu shot, we can prevent all of that.
And who needs an annual flu vaccine?
Everyone needs an annual flu vaccine as long as you're over the age of 6 months.
Right. Do pregnant women need a flu shot?
All pregnant women should get a flu shot, and that will protect themselves from getting the flu as well as protect their babies.
My name is Jiwon, and I work for a TV network, a Korean TV network, South Korean TV network called SBS, Seoul Broadcasting Systems. And I was here to get to see Dr. Frieden and to network with him basically. And I heard that they were giving away free shots, so I'm in line to receive a free shot. And my dad's coughing every morning; he's sneezing, coughing, so I think I have to get this shot. I'm standing in line to get one because I don't want to get sick, and I want to come to work, and I want to I want to come to work, and I want to go out to do things and see these kinds of events, and get free shots. So that's why I'm in line.
Are you not scared of the freak?
Well, I don't. I am scared of it, but it's free, so I'm getting one. I don't want to get sick.
Hi, I'm Donna Mazik, and I'm waiting to get my flu vaccine for 2015. I do this every year for my health, for my family, for my community, because I know that I am protecting myself and those that I work with and love and live with from a disease that is preventable.
Does it hurt?
The needle can hurt. It's momentary. The flu hurts much worse. If you've ever had the flu, you'll sign up for the flu vaccine.
I'm ready.
Hi, my name is Fran Carpentier. I'm from New York City. I'm waiting for my flu shot. You have to understand, I don't wait in line for anything. I wouldn't even wait in line for Bruce Springsteen, but I'm waiting in line for my flu shot, not only for me, but for my family and friends. I want to make sure I'm not spreading any bad bugs. So get your flu shot. It's just really cool. I hear Lady Gaga's doing the same thing this week. Hi, I'm getting my flu shot because I'm not only protecting myself, but I want to protect everyone I come into contact with. I'm taking buses and trains all the time. I work in an office, and of course, I'm concerned about my family and my friends. It's the right thing to do.
Well, the thing that motivates me to fight flu is the ability to prevent illness and death in people that are affected by flu. Flu is a bad disease. It causes millions of cases of flu every year. It causes hundreds of thousands of hospitalizations and thousands and sometimes tens of thousands of deaths. And so anything we can do to prevent that, that's what I want to work on.
What are the best ways to prevent flu?
Well, the best way to protect yourself is to get a vaccine. You can get vaccinated starting right now, which is in October, but you can go all the way through the season and get your vaccine. There are two other things that you can do, though vaccine is the best way to protect yourself. But you can also take everyday precautions like staying at home when you're sick or covering your cough and washing your hands. But also if you do get sick, talk to your doctor and see if you need antiviral drugs, because those can also help treat the infection.
So who needs an annual flu vaccine?
Well, the CDC recommends that everyone 6 months of age and older get their vaccine. There's lots of different kinds of vaccines you can get, and there are lots of different places you can get it. So everyone 6 months of age and older should get a vaccine.
So what motivates me to fight the flu is first and foremost my 3 daughters. I want to set an example for my children and my family. And the other part is, as a part of the American Pharmacists Association, we are big believers in the immunization neighborhood. We need to set an example as pharmacists and get vaccinated for the flu.
The March of Dimes is passionate about supporting vaccines. We were founded over 75 years ago for the express purpose of creating a vaccine to prevent the scourge of polio. So the March of Dimes has understood from its very beginnings how important it is to protect our children, to protect our communities, to protect the ones that we love through vaccines. So we support all of the CDC recommendations, and we urge everyone to be fully vaccinated.
So my name is Kathy Newsel, the Director for the Center for Vaccine Development at the University of Maryland School of Medicine. I'm motivated to fight flu for many reasons. I certainly don't want to spread influenza to any of my patients. I don't want to spread influenza to dear friends of mine who have breast cancer, to my elderly in-laws, to my family. And I don't want to get flu myself. You know, it's not a fun illness. You feel bad, you miss work, you're in bed for a while, and in rare cases, you can be hospitalized or die from flu. So I am motivated to get flu vaccine for myself and for others.
I'm Wendy Sue Swanson. I'm a pediatrician and the executive director of digital health at Seattle Children's.
What motivates you to fight flu?
Well, I'm motivated by really the great potential that influenza is a virus that we know comes around every year. We know kids in particular, 10 to 40% of them get it every year. And we know that our best prevention is really getting that flu shot early, washing our hands, and staying home when we're sick.
Is there any truth to the autism vaccine link?
Well, certainly we hear lots of stories, and we know that science has never found a link between vaccination and autism spectrum disease. Let me say it again. Cut that. It's disorder.
Should I ask?
Yeah, ask me again.
Okay. Is there any truth to the autism vaccine link?
Well, we certainly have all heard lots of stories, and we know they've never found a scientific link between vaccines and the development of autism or autism spectrum disorders. You know, there have been countless, almost distracting studies at this point with concerns that have come from the public about a purported link that was based on a false mythical statement that came kind of in the late 1990s. What we do know is that we need to direct our energies at understanding how to diagnose and support children and their families who do have challenges with communication and autism spectrum. What we know is that vaccines are some of the most tested and safe interventions we have in healthcare and in medicine, and we know that the benefit far outweighs the risk.
William Schaffner, S-C-H-A-F-F, as in Frank, N-E-R, an infectious disease physician at the Vanderbilt Medical Center in Nashville, Tennessee.
All right, making eyes at her only.
Easy.
Why is preventing flu important?
Well, prevention to me is the first goal of medicine, the highest goal of medicine. And if we can prevent disease, that's much better than having to diagnose and treat it. So I would like to prevent as much influenza as I can. The recommendations are we should vaccinate everyone 6 months and older. Don't think about it, just do it.
What are the best ways to prevent flu?
Well, the fundamental best way to prevent influenza is to get vaccinated, of course. Now, beyond that, we can do all sorts of things. Wash our hands, cough and sneeze etiquette. If we're sick, stay home. And then, of course, if we do get sick, get treatment.
Who needs an annual flu vaccine?
Everyone needs an annual influenza vaccine. That is absolutely the best way to prevent influenza. You know, we protect not only ourselves, but those around us. If you get vaccinated, you won't be a spreader. You won't give it to your aunt, your parents, your grandparents, or to some young child. Get yourself protected and also help protect the entire community.
When is the best time of year to get a flu vaccine?
The time to get the flu vaccine is when flu vaccine becomes available, usually around mid-September. Get it as early as possible. If you happen to put it off, if you're tardy, get it anyway, even if it's after Thanksgiving. If it's in December or January, get vaccinated, because flu in this country usually peaks in February.
What are the symptoms of flu, and what should I do if I think I have the flu?
Well, the symptoms of flu are sore throat, fever, cough, feeling crummy, often aches and pains, sometimes milder, sometimes more seriously. If you get the flu, keep to yourself. Don't spread it to others. Cough and sneeze etiquette. And particularly if you're older, if you have any kind of underlying illness, be sure and contact your healthcare provider, because you may get an antiviral to reduce the course of the illness. A population that we're especially interested in are women who are pregnant. It's very important that they, during the influenza season, get vaccinated against flu. It's not generally well known that women who are pregnant, if they get flu, have rates of complications comparable to the complications that seniors have, so it's dangerous for them. Now, there's another benefit. If the mom gets vaccinated against influenza, some of that protection crosses the placenta and goes into the baby. The newborn has some of that protection from mom during the first 6 months of the newborn's life before we can vaccinate the newborn. 2 for the price of 1. Protect the mom herself and protect her baby. If you tell these pregnant women that vaccinating them will protect their baby, they start rolling up their sleeves.
Jennifer Miller, and I'm a family that supports Families Fighting Flu.
How are you?
flu?
We've been impacted greatly by the flu, and I'd say our family, our schools, our community at large, because of in December 2012, our daughter Caroline, who was 5 at the time, came down with the flu rapidly. She was literally doing cartwheels off of a couch one morning, and by that evening, she was unable to breathe. She was panting. I liken it to, almost like rapid breathing. And we took her to the emergency room in the middle of the night, and the first thing they did was to test for flu, and she came back positive for influenza A. That evening, they told us there was nothing they could do at that hospital. They needed to send her to a children's hospital in our area, and that she would need to be taken by ambulance. I think that was the first sign that I realized this is severe, because at that point I thought we were going to drive her to this other hospital, and the reason being was because she was in need of oxygen, and that's not something you can just give a child in your own car. You have to be taken by ambulance. We made it to the second hospital, and by the following day she had to be intubated, and she again was told, our family was told, there's nothing more we can do for your child. What she needs is a special oscillating ventilator in order for her to breathe. So what we were looking at was the onset of sepsis, acute respiratory distress syndrome, and respiratory failure. And so she had to be airlifted to the Children's Hospital of Philadelphia, where she was placed on that oscillating ventilator, which they offer. And she spent 2.5 weeks in the PICU on life support. And it affected us unlike anything else. And I think the biggest thing I can stress to families and parents is you don't have to have a previously ill child. This child was healthy. She's a swimmer. At 5, she was swimming 4 times a week. So talk about strong lungs. And unfortunately, influenza doesn't discriminate. It caused double pneumonia, and it took almost 3 weeks to get her out of the PICU and then into recovery, at which time, by that time, she'd lost 50% of her muscle mass, so she was unable to walk. She had memory loss. And I'm happy to report she's fully recovered. But because of an error in judgment and not getting her flu vaccination that year, we had put it off. It wasn't available at the time, and I kept telling myself, oh, we'll do it again, in a few weeks. And I didn't want to take her out of school to do it. And before you know it, we're in November, and then it's December, which is the height of flu season, or at least it was that year. And that lack of judgment nearly cost my child her life. So we have been tremendously impacted, and it's, I feel like it's my duty to share the story with families so that there isn't another story like this.
What do you want to tell others about flu?
That flu, as I mentioned before, it doesn't discriminate. It doesn't matter. They say that younger children are obviously more susceptible at catching the flu, but it can be a very healthy adult or child. And if you're vaccinated, you have a much better chance at a better outcome. And if you're not vaccinated, you're playing a roulette, essentially. And so I feel like as a parent, you wouldn't dare put your child in a car without a car seat or a seatbelt, and you shouldn't dare put your child in school in the fall without a vaccination.
Why is flu vaccination important?
Flu vaccination is so important, not just to children, but to your entire family. If you have children, it's just as important for you to be vaccinated so that everybody is like a cocoon around those children. And this year, before the start of school, we all went on Labor Day weekend to several different pharmacies until we found a pharmacy that could give all 4 of us our flu shots. It's important because it saves lives. In December 2012, we nearly lost our child to flu. Had I known how severe her symptoms could be, and had I known that she would be on life support for 3 weeks, there would be no question in my mind that I would have made the time and the effort to get her vaccinated. We will never make that mistake again. And it by far is the greatest failure in judgment I've ever made in my life. I think it's so important to share our story because I would never want any other family to go through what our family went through. Caroline obviously took the brunt of it because she was the one that was ill, but it affects every member of the family, the siblings, the parents, the grandparents, the kids at school that the sick child goes to school with. It affects the entire community at large, and I can't emphasize enough the importance of getting vaccinated each and every year.
I'm Meryl Olson. I'm Executive Director of Families Fighting Flu. As Executive Director of Families Fighting Flu, I've heard many stories about the devastating effects of influenza. Our organization is comprised of families who have experienced the devastating effects of flu. Their children have died. They've experienced hospitalization with severe complications. And our mission is to educate all families about the seriousness of flu, that it's preventable, and that all families should get vaccinated every year against the flu.